Thank you, Mr. Chairman. Thank you, Chairman Bernanke, for staying with us for a second round. Let me just ask a follow-up to something that was asked a moment ago, I think, by Senator Sanders, and it certainly comes up in every town hall that I do back home. He talked about a failure of the financial system and a failure of the regulatory system. In your opinion, why wasn't there a more aggressive effort to find out what went wrong and who was responsible, perhaps even prosecute someone for those failings?
Well, the Congress set up a Financial Crisis Inquiry Commission, and it provided a report, and that was your
It was pretty ineffective, wasn't it? And we certainly had nothing to compare with the Pecora Commission of the 1930s that arguably a lot of people wanted to see. Water under the bridge, and I acknowledge that. Let me ask you this. When we came up on that August 2nd deadline this summer, and there was some concern as to whether or not the debt limit would be extended, what was keeping you awake at night then? And did you have any contingency plans that you were putting in place at the Fed to deal with the fact that Congress might not extend the debt limit?
Oh, we certainly did have contingency plans. We are, first of all, the Fed is the fiscal agent of the Treasury. I mean, we are technically responsible for getting the payments done. And so we were working on plans of how we would address the situation if the government had to cut back on what it was paying. So we were dealing with that set of issues, and we were also looking at what we might be able to do to try to reduce the impact on financial markets and on the banking system. But we were quite concerned that the failure of the Congress to pass the debt limit on a timely way would create a crisis of confidence in the financial system, and we weren't quite sure that we really had tools to address that.
I don't mean to interrupt, but my time is short. Would that crisis of confidence in any way have mirrored or matched the crisis in confidence that occurred after the failure of Lehman Brothers?
If there had been a default on U.S. debt, it's possible that you would have had something in the same order of magnitude, yes.
And did you have tools to deal with that?
We would have had some palliative tools, but we couldn't have prevented a very serious crisis, no.
Well, let me just ask you another question, because we are all now focusing on the Debt Commission. Your predecessor, in talking to a group of us right before he left, a question came up about Medicare and the long-term financial sustainability of Medicare. The chairman thought for a moment. He said, I believe when the time comes, Congress will make the necessary adjustments and the sustainability of the Medicare program will continue. He stopped for a minute and then he said, what concerns me more is, will there be anyone there to deliver the services that you require in that program? And that was a pretty powerful statement for him to make, and one that has concerned me in the now 5 or 6 years since. One of the things we're looking at in the Deficit Commission, if the targets are not met, one of the rescissions is going to be in the Medicare system, not to affect beneficiaries, but likely be on providers, which I would argue will ultimately affect beneficiaries. Do you have any thoughts or any concerns about that?
Well, there's a constraint, which is that physicians and hospitals don't have to take Medicare patients, and so you have to pay enough to induce them to do so. Which makes me think that the fundamental issue is getting healthcare costs down and making our healthcare sector more productive, not just in terms of Medicare, but in terms of our entire economy.
And in your opinion, is centralized command and control of the healthcare system the way to do that?
I'm not going to. There are lots of different ways to address healthcare and lots of different models around the world.
Maybe we can visit about that more in the future.
We can discuss that later.
Mr. Chairman.
Thanks, Representative Burgess.